Top of the morning, Mike Galbraith here. I'm a family and sports medicine physician, and I have the pleasure and honor.
Brian Boehme, physiotherapist at Elite Sports Medicine. It's my pleasure as well.
You are the pleasure. And it's good to be with you.
I won't take that the wrong way.
All right, we'll just keep going.
I appreciate that. I appreciate that. We just talked about some TheraBand exercises for a rotator cuff, shoulder kind of pain, but we're going to change it up a little bit here. We're going to use 5-pound weight. For some patients, it might be a little bit heavy, but I think for Mike in this case, it's a piece of cake.
Yeah,
but you
definitely.
could use lots of different variations at home. You could use a can of beans. You could use a can of corn. I mean, that might be 2 pounds, and that might be more appropriate for lots of patients.
You're going to make me hungry. Which
is totally fine. We'll go out for lunch after this. But I'm going to have you lay on your side.
Okay.
I'm going to get around behind you so they can kind of see you, and I can kind of walk you through it.
Sounds amazing.
All right.
I can hardly wait.
Okay.
My shoulder's pretty sore, so it better feel good here.
All right, so just right on your side, you can double up that pillow just like that. We're looking for comfort here.
I'm pretty
comfortable. For a lot of patients, on your couch, on your bed, just make sure you don't roll off, but for the most part, you should be pretty safe. I'm gonna take this weight, have them grab it in that hand. Now, if a patient has an acute injury or soreness in the shoulder, that might be a little hard to just lift, so I'd say don't be afraid to use the other hand just to help out. Even just to support it if it's maybe too heavy, or if they're needing a little bit of help through the range initially. Just kind of depends on the patient. So let pain be your guide for now. The reason why I'm going to have you in a side-lying position, because you can also be in a fairly stable position, just like he's doing right now. I might be picky and have him roll completely on his side so he'll get more range. As he comes like this, it's just more supported. It'll make it easier. A lot of patients might cheat like that. But for now, right on his side, arm right beside him, and all I'm going to have him do at this point is just going through a range where he's going to extend or rotate that out, and then slowly back down and back up and back down. Now, if he can go through a greater range, as long as his arm stays stable like this.
No, it's okay.
Then don't go that high. But as long as his arm stays at this position, he's much less likely to kind of compensate, cheat with other muscles. And also, yes, and that's common to see patients starting to really, or as it gets harder, they might start to lean out this way, and like, I'm going through a good range. Well, not really, you're just cheating a little bit. So really, as best you can, keep this arm as locked to your side as you can. Kind of pretend like you got a strap around your arm. And you're just going up and back down.
Yeah, you feel it work,
Simple
even
stuff.
just a few
Simple
reps.
stuff.
You bet.
So that's external rotation. Basic once again. Now we're going to look to internal rotation. Once again, have him try to tuck that into that side as best he can, and then bringing that up to his stomach, and then nice and slow back down again. Just like that. Just like that.
And you taught me if I go right on the edge of the table, I could even kind of go a little bit beyond,
further
right?
into it, further into that rotation.
Increase
for sure.
that range.
So it just depends on the patient. Some patients, they like that support, so they might be a little more onto the table. Then they can't go past neutral. But if you can go past neutral and get a further range, I'd prefer that. It just depends on how you're feeling.
And you definitely find this external rotation is easier than that internal. So I mean, I could easily do more weights.
Internal
on this
rotation.
side,
I'll just
sweet. That's great.
Questions?
I think I'm pretty good.
Excellent.
So it sounds like lock it in, stable, slow, controlled motion.
Keep it stable, slow, controlled. I think you'll be less likely to irritate something, less likely to compensate. So that looks pretty simple.
Yeah.
Well, we'll keep it that way with stuff like this, just so you can reproduce it at home.
Final question: how good are your reflexes? Wow,
They've
not
been
bad.
a little slow lately.
That's right. Have a great day.
Thanks.